Hello. This is the syllabus review for the application of the OT process Older Adults 1 Behavioral and Physical Health course. This course is worth 3 credits. I am the course coordinator and instructor, Dr. Danielle Mahoney. My phone number and email are listed there. Definitely, I think the best way to reach me is through email. I usually answer within 24 to 48 hours. Feel free, if you don't hear back from me right away, to send a follow-up email. My office is located in the Georgian building on the third floor in room 331. The office hours, because this is a little bit of a different structured course, being an intensive, are by appointment because we are together most of the days. If you need an appointment during a lunch break or before classes or after or even after 7 p.m., just send me an email and we can set up a time as soon as possible. The course location, all synchronous sessions of this course will take place in LL 206 unless otherwise specified. And the learning management system is Canvas, which you are all used to at this point. Your required textbooks are listed here. These are the textbooks that you will definitely need as you study for this course, Older Adults 2 that you will take in the fall, as well as when you prepare for your boards. These are the recommended textbooks listed next. You don't have to purchase these. I also have these available in my office if you want to review them at any point, but they do serve as good supplementary information to what you are learning in this course. The course description. So, this course will provide students with an opportunity to increase knowledge concerning aging disease states and interventions appropriate for older adults. I like to tell people that the summer sets the foundational knowledge of what is normal aging. Most of what we will review is about what is the normal aging process this summer. By the end of the summer, we start to get into more specialty topics, and definitely in older adults too. In the fall, you focused on much more specialty topics about older adults, such as driving and sexuality, and what else is there? And vestibular rehab. So we will get all into that in the fall. This summer, we need to lay the foundation so you understand what normal aging looks like. Occupational therapy's role with older adults in varied practice settings and contexts will be introduced. Course content covers principles of health promotion and wellness, prevention, and rehabilitation approaches for older adults. Specific assessment and intervention strategies are reviewed with consideration for practice within traditional and community-based settings. Content of the course also addresses issues and special topics for older adults throughout the continuum of care and varied contexts. Evidence-based practice literature is applied to support the role of occupational therapy evaluation and intervention strategies for areas of practice with older adults. Special considerations for working with older adults are emphasized, including client-centered practice, the role of interprofessional collaboration, technology, and health literacy. Strategies to enhance participation, engagement in meaningful occupations, improving and maintaining quality of life for the mature adult is examined. The course format. This course incorporates both synchronous in-person group sessions, asynchronous learning activities, and independent learning. Sessions include lecture, group discussion, experiential learning activities, videos, and case-based learning. The Older Adult Fieldwork 1 is an integral part of the older adult curriculum sequence. Course content provides a foundation and preparation for the application and integration during Fieldwork 1 experience during the fall semester, which will really be closely linked to your coursework and assignments in Older Adults 2 in the fall. The curriculum design. I'm sure by this point in your curriculum, you are very familiar with this image, but let's review how this applies to your Older Adults 1 course. This course focuses on and builds on the integration of foundational knowledge gained in courses early in the curriculum, such as human anatomy, kinesiology, clinical conditions 1 and 2, approaches and models in OT, and assessment and evaluation, specifically related to the aging process and working with older adults. The knowledge gained in this course challenges students to apply and integrate the use of occupation through the aging continuum in varied contexts and environments. Working with older adults requires the understanding of how different individuals learn and how occupational therapists can optimize the learning experience. This is your caring domain. Students are encouraged to look at individuals with a different perspectives as they face challenges through the aging process. This is your human dimensions domain. Through formative and summative assignments, the course offers the students the opportunity to critically reflect on their learning and understand the aging process. The course integrates the curricular threads as follows. I'm not going to read through all of these, but I really highly encourage you read through every piece of this syllabus, especially this part. We connect it to occupation, context and environments, diversity, equity, and inclusion, scholarship, and leadership and advocacy. In this area of the syllabus, you can also see how your assignments are linked to these curricular threads. The next portion of the syllabus outlines the course objectives. In this chart, you'll see how, just like I was saying before, your outcome measures are linked to your objectives, and the instructional methods used to help you reach those outcome measures are listed within this chart. The ACOTE standards that they are also supporting are listed. So your course objectives are as follows. The first is to identify age-appropriate roles, life tasks, developmental issues, and occupations during the mature years and the psychological effects of the role of identity changes that occur later in life. You'll be able to describe the roles and purpose of meaningful occupations in promoting health, wellness, growth, and fulfillment of needs during the mature years. The second objective is to identify and apply health promotion and prevention strategies for use in a variety of practice settings. The third is to analyze the effects of disease processes, including heritable diseases, genetic conditions, mental illness, disability, trauma, and injury on occupational performance throughout the aging process. Your fourth objective is to describe the varied roles of occupational therapists within a variety of settings and models of service delivery for geriatric clients, including traditional and emerging practice areas. Demonstrate the role of the OT consultant by identifying programmatic needs of community agencies that serve older adults and organize, plan, and market an appropriate intervention plan to address those needs, thereby promoting wellness and preventing dysfunction. This sounds like a huge objective and a big undertaking, but I promise you, by the end of this summer semester, you will have developed a rationale, you will have conducted a needs assessment, and come up with a draft of what your program will look like when you go to Fieldwork 1 in the fall. Your fifth objective is to demonstrate the ability to perform and analyze an evaluation of an older adult's occupational performance in ADLs, IADLs, education, work, play, rest and sleep, leisure, and social participation using standardized and non-standardized tools. Your sixth objective is to describe appropriate direct and/or indirect service interventions and discharge planning for care of older persons along the continuum of care within the context of occupational performance. Next is to demonstrate an understanding of the varied use of technology to provide education and support the performance, participation, health, and well-being of older adults in varied contexts and settings. Sorry. And lastly, to promote aging in place by utilizing clinical reasoning to perform home evaluations and implement environmental modifications by applying principles of ergonomics and home modifications. We're now going to review the course policies and procedures. This is consistent with every other course you've had in the program, but just to serve as a refresher as we go into this intensive course. The first is that our program is a hands-on, face-to-face program with virtual components that are guided by the philosophy of adult learning and professional education. We expect all students to attend classes, be on time, and be engaged as is required in a clinical work setting. Like we always say, you want to treat the classroom as the clinic. You want to be as professional, as on time, as prepared as possible. If you cannot attend class, you are expected to email the professor prior to class or as soon as possible. I completely understand that life happens, but the more you communicate with me, the better I can help you. So even if something happens and you can't get to me till after, still that email after matters. It's going to help me guide you in how to catch up on the work or how to figure out a certain aspect of the course. As the instructor, I have the right to lower the final course grade by one full letter grade due to excessive, which is considered 15% or greater, unexcused absences, lateness, and unprofessional behaviors. If your class average is a B, your grade would be entered as a C. If your class average is a B minus or below, you will receive an F for the course, and passing in our program is a C. Excessive unexcused absences, lateness, and unprofessional behaviors will also result in feedback through our professional development system. Students who miss 20% or more of classes due to unexcused absences are subject to fail regardless of the overall class average. The second course policy is that students that miss 20% or more of class time due to a combined excused or unexcused absences must develop a learning contract at the discretion of the course director to address the missed course content. The third is about late submissions of assignments. The grade will be dropped by one grade increment for each calendar day that the assignment is late. For example, if your grade on the paper is a B and the paper is one day late, your grade will be dropped to a B minus. If your grade on the paper is a B and the paper is 2 days late, your grade will be dropped to a C plus. The fourth policy is about class participation. The instructor has the right to lower the final grade by one grade increment due to poor participation. Participation in this intensive course looks very different in all different activities. Some will be small group work, some will be large group discussions, some will be really about the interactions. You're going to be trying out visual simulators, you're going to be creating empathy maps. So participation doesn't just count as raising your hand in class. I know that's not everybody's strength, and that's okay. But there are other ways to show how you are demonstrating your knowledge. Turn it in is the fifth policy. So all written assignments must be submitted to Turnitin. The grade will be dropped by one grade increment for each calendar day that the assignment is late. 6 is that all papers require APA format for citations in the body of your paper and for references. 7 is that assigned reading from all required textbooks, reserved journals, or viewing of required videos. It is expected that these are done prior to class. Okay, so all the readings that are listed for the topics on your syllabus that you will review in another video are required to be completed before that class time unless otherwise specified. Materials from the readings and the videos will be tested on exams. Policy number 8 refers to the student handbook regarding policies for professional behavior, guidelines for participating in Zoom class, and excused absences, lateness, and exam policies. It is expected that all students will follow policies and procedures outlined in the handbook. Number 9 is about sensitive course topics. This course may cover sensitive topics and/or use videos and illustrations that may be sensitive and elicit an emotional response from students. The course instructor has made sure that these topics, videos, and illustrations are important for learning and essential in training for competent clinical practice. If any student feels that such topics evoke a strong emotional response, the student is strongly encouraged to meet and discuss such topics with the course instructor and/or program mentor immediately after class. This is definitely true for our older adults course. There are topics, there are videos that might strike a chord with all different people that I might not even anticipate. Some of them I do definitely anticipate seeing over the years of teaching. I can know which video might invoke an emotional response, and I try to give you as much heads up as possible. But sometimes something is just really sensitive to you, and I welcome your feedback. I would really appreciate you communicating with me, if not your advisor. I don't want you to sit with these feelings and let them fester, and impact your learning experience. Course policy 10 is about photo, audio, and video capturing. Students are not allowed to capture photos, audios, or videos of faculty, students, and/or clients or patients during class and fieldwork activities without a formal written request and approval from all parties involved. Verbal request and approval do not constitute a formal permission to capture capture photos, audio, and video. Social media policy. Identifying yourself as a student in the programs of occupational therapy at Columbia University Medical Center when creating your social media accounts indicates that you are abiding by professional standards, responsibilities, and program and university policies. Any comments, photos, audio, or videos shared and tagged on social media may be publicly reposted or screen captured regardless of your privacy settings. Federal policy laws such as FERPA and HIPAA apply to various forms of communication, including social media. As written in the program bulletin and student handbook, no photos, videos, or audio recordings may be shared on any social media account without formal written consent from all instructors, students, and the stakeholders involved. You are also required to refrain from taking and posting any information, commentary, and electronic artifacts related to the classroom, community, and fieldwork experiences without the written consent of stakeholders involved. Violation of such policies will have serious consequences. And lastly, we're going to speak about the remote proctoring of exams policy. We do have two remote exams in this course. CUOT requires the use of a second mobile device for live proctoring during remote exams. Please refer to the OT program bulletin for full guidelines. I'm sure by this time in your curriculum, you have experienced the mode of taking a remote exam. But of course, if you have any questions as we get closer to the midterm or the final, I'm always here to talk about it. So that concludes this part of the syllabus review. Please print this out or store it on your computer and refer back to it whenever you need to throughout the course.